Chrissy, would you please call the roll?
Calling the roll, Mr. Jones,
Here.
Ms. Conwell,
Here.
Ms. Brown. Ms. Brown is absent at the moment. Mr. Schron is absent at the moment. Mr. Miller.
Here.
We have a quorum.
Thank you. Again, welcome everyone. We have a few items on our agenda today. A contract for our Children and Family Services, and we have a presentation. And we will follow our agenda as it's laid out and have a discussion on our appropriation first. And Chrissy, before we get to that, has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
All right. Can we have approval for our minutes for the May 4th meeting?
I so move.
Second.
Moved and seconded. All in favor say aye.
Aye.
Aye. The minutes are approved. Again, no matters referred to committee. And our first discussion will be for our additional appropriations for the Department of Children and Family Services. It's a new program, so we want to hear about it.
Council Vice President Jones, good afternoon. Councilwoman Conwell and Councilman Miller, good afternoon.
Good afternoon.
I have
And
the list. How would you like to proceed, sir? Do you want me to go
first,
through
I
it?
wanted to start by apologizing to you because we had a meeting scheduled last weekend. I ended up going out of town and we didn't get a chance to connect, but we will do that.
Looking forward to it, Councilman.
All right. But in your own way, again, for us, it's a new program, so we just like to get a little insight into it as well. So,
Sure. Let me start by saying a small correction first, that this is not new programming, and this is not new money. We are asking, there's some realignment. This is all about realignment of a budget for us right now. And we have the funds in our overall budget, and we have the details of where the realignment is coming from, and I'll submit that for your review once I'm done here. I'll just go through the list if that's okay with you folks, and we can go from there. Starting off with the Opentable Contract, it's a $70,000 contract. This is an expansion of our mentorship program. I've talked about this over the past 8 or 9 months, where the Opentable is a way to address the youth aging out of our system. We have about 110 to 120 youth per year aging out, unfortunately, out of the Child Family Services system. And the mentorship, or this Opentable concept, instead of doing a 1-to-1 mentorship, it does a 10-to-1 mentorship. It's the youth acting as its own like CEO, and there's 10 adults around the youth to provide them social skills, resiliency, opportunity, and options. It's a national model that the 70,000 contract is used to bring the person in to facilitate all these mentorship programs that we're doing. That's what this is for. And again, this is an expansion of our mentorship. Our mentorship program needed to get reworked, because what we're doing is these 110 to 120 youth that are aging out of our system are not getting paid attention to, and this is one area that I wanted to readdress, and this is how I chose to do that. But again, good afternoon, Councilman Greenspan. Again, this for me it's not new money. This is money already allocated in my budget that I'm just realigning. Is there any questions on the Opentable before I go to the next one?
if you have any questions at this point,
No, we're talking about the items under number 6.
we are
on the
just
agenda.
discussed the $70,000.
This is the first
Okay.
one, Councilman, $70,000.
Yeah, the reason that, if I can, Mr. Chair, the reason that I asked for these items to be pulled has to do with our code as it relates to new programs. And in our code, under 701.04, it calls for 4 items to be presented anytime there's a request for new programs or services. Obviously, a program or service overview, a program or service budget, program or service milestones and timelines, as well as program or services staffing levels. And I just didn't see in the information that was provided that those 4 criteria pursuant to our code were included in the package.
I can get that to you within 3 days after this meeting today. I can talk them through each one by one now for you if you like. I have answers for all 4 of those questions, but I'd be glad to put that in writing and get it to you before the end of the week or by Monday latest.
Okay, and just so, and Mr. Miller, I don't know if you discussed this, but that was the reason that Mr. Miller and I talked about pulling these items, was the lack of information, once again pursuant to our code for the request. Because as you can imagine, seeing a request for $70,000 or $1 million without understanding
Absolutely.
what the money's being used for is problematic.
My mistake. I apologize for not having that for you.
Okay.
For the count.
All right, thank you.
No further questions on this particular point. Please
Okay.
continue.
The next one is 135,180, and that's with the county prosecutor's office. That is an agency error that we have found that we did when we submitted our budget reduction to council this past November.
Tom, I'm sorry, I'm not finding the 135,000. We just discussed the 70,000.
Correct.
I don't see the 135.
It's CF 135467, and do you have an extra copy, Walter, of that I can give? May I approach?
Yes. Is it?
It's the second whole line right there.
It's listed as, through the chair, it's listed as 205,000.
No, that's you add 135 and 70 together, gets 205, 180.
Got you.
Okay.
Okay.
Again, as I mentioned, this is when we submitted our budget, this was an error, a mistake that we made, that I'm responsible for, that this 10% came out of the county prosecutor's budget, should not have come out of. We do have a current contract that is viable, and we're trying to put that money back into to cover the contract for the remainder of the year. And again, we do have the money in our budget, within our overall budget, and we're looking to make that whole.
So the total dollars toward the expansion of the mentorship program are 205,000.
No, I'm sorry, Councilman, Mr. Vice President. 2 separate things. The $70,000 is a single contract for the open table. The 135 is a contract with the county prosecutor's office so that we can provide legal constructs for our children in foster care. 2 separate contracts.
I'm sorry, I'm
Are
not
there
a
any
member.
questions?
Yeah, thank you.
Unless you get out of control, feel free to
No.
just ask your questions.
I'm-
Right.
I'm maturing. The, just so I understand this, item G has the request for increase in programs, and item H is how it's being funded by a reallocation of existing funds. The 70,000 in the second item, is that different than the 70,000 you talked about in the 205 as being part of the 20? I'm having a tough time following the math.
70,000 that I just initially talked about is the open table contract. The other 70,000, stay up here with me, Walter, on this. The way this is laid out, this has been added up, and what I want to do is go through these separately and individually. The first item I talked about when you walked in, Councilman, was the 70,000 for open table. Second item is 135, 180 for the county prosecutor's contract.
Okay. So the 70,000 you're talking about is not the 70,000 explicitly listed on this report, on the request. That's a separate 70,000. We're under Children and Family Services, direct services, other expenses. That's a different 70,000.
That's a different 70. That's an addition.
Okay.
That's an addition of 2 other numbers, sir.
Okay, all right, thank you. And that's why it's important that the protocol
I understand. I
be presented so
apologize.
we don't have to ask these questions. All right, thank you.
So again, just to close the loop on this, the second one, this county prosecutor's contract, the reduction we did in November was a mistake, an error on my part, and we are correcting it. This should not have been done. We should not have taken 10% away from the county prosecutor's contract And we just found this out over the past couple days, and we are trying to make that whole so that we can continue on with our business with them. If no other questions, I'll go on to the next one. The next one is a $40,000 capital purchase, conference room, tables, chairs, lactation room, furniture, equipment, replacement chairs, ADA, et cetera, $40,000.
Where is this located? Where are these chairs located?
For Jane Edna.
Jane Edna.
Part of this is the infrastructure for HHS is non-existent. Part of this is rebuilding the capacity to manage HHS with getting the right equipment so that I can manage the overall 9 operating departments. And so part of this is that. The lactation room is something we're trying to do in order to provide a service to our families that come in, but the rest is just pro forma process that we're looking to increase, and we're asking for $40,000 in that amount to do that.
Go right ahead.
Mr. Chair, my apologies for my tardiness. With regards to the $40,000 in the furniture, is this additional or is it going to be replacing some furniture? Are you adding?
It's both. We're going to be replacing some. We're also creating some. I created a conference room that was big enough to handle the infrastructure for HHS that we didn't have. And so that part of it is that, but it's also part of replacing some of the other older furniture that we have. It's also the equipment, the video, the screens, et cetera, so that we can have the technology to do the work that we need to do.
Now, with regards, I know you mentioned the conference room with regards to the addition, and I know there has been some discussion with regards to the Southgate Family Center and the staff moving. Is any of this furniture to accommodate the future staff that could be coming?
Yes, we've also included, as you know, part of the budget we had earlier was, I think there's 500 or 600 chairs we ordered over the past year. This is an augmentation to that. Also, the 70 staff out of Southgate is coming between Thanksgiving and Christmas this year. And it's, again, to provide the infrastructure so that we can continue to do the business we need to do at an appropriate level.
Okay, thank you.
Okay. Councilwoman?
This is on a different topic, but just wondering if you could stay after. Providence House is going to present, and they're assisting the county in a way that will be explained in presentation, but we don't fund them or assist them with funding. So, and I believe that would fall under your category.
Yes.
So if you could just.
I'd be glad to. Thank you, Councilwoman. The next item, 135509, $40,000 admission to Great Lakes Science Center for Children and Families. This is to serve over 1,000 children that we have open cases with for a one-day event for back to school. This is a new item. And to Councilman Greenspan's request, I will take each of these items that we're talking about now and have a answer to all 4 of those questions to you by Monday, or to council representative by Monday. This is a one-time event. It's not an annual event. This is something that we are using in order to provide stability and a foundation for these kids getting ready for back to school. It's a $40,000 price tag on this.
So if I'm clear, you're taking the children to visit the
Yes.
Great Lakes Science Center
For a day, for a full day.
for one day, taking 1,050 children
Yes.
on a one-day event. And that's
Yes,
40,000.
Council.
Any
Councilman.
questions?
Yes.
Councilman?
Where is this item listed? We covered the 205, which has 2 parts. We covered the 40,000, which is the chairs and stuff.
Councilman, they're not on our
You
sheets.
want to say,
It's on the sheet he gave.
It's part of the $70,000 labeled under G.
Is it part of the 70,000 labeled direct services?
Yes,
Okay, so that one also has other components.
it does.
Yes,
Okay.
and I'm sorry, what I did was I broke these out individually so that I could explain each one, because it's not aggregate, it's individual.
And I hear what you're saying, but it's not clear to me, because when I look at G, I see 205,000, I see 40,000, 70,000, $8,800, 24,999. But does that capture everything? Okay. And these are the same? And have you seen this? It is the same. Okay, all right. I will read as you speak. Please continue.
And Councilman Jones, I apologize for the presentation being disjointed. I want to be able to not make your job harder. I want to be able to have a way for you to understand each of these items. I should have had a different reference point to hand out to you when I started. In the future, I'll take care of these issues to make sure that the paperwork you have is the same paperwork that we're working off together. So and the Great Lakes Science Center for Children and Families, again, for over 1,000 kids that we have open cases on. These are not children in custody, but they are open family cases that we are working with to keep them out of custody. And this is a way to stabilize their foundation and infrastructure for them getting them ready for back to school, a one-time event.
Mr. Chair,
Councilman Greenspan?
did you ask the Science Center if they would donate these tickets, or did we just assume we'd pay for them?
I don't have that specific information, Councilman. I will check on that.
Because as we found out, there are many organizations that will donate for
Yes.
specific purposes, and that would save us some money. It also is goodwill for them.
Without a definitive answer, what I will tell you is that my staff have worked that process many times with other organizations, so I'm in a 90% confidence range that they did ask, but I'm not at 100% ready to say that they did, so I will get back to you on that, sir.
Okay, thank you.
Through the chair, on that same line of questioning, just wondering, do we do this on an annual basis, and do the children go to different sites?
This is the first time we did this. We want to see how it goes and what type of outcomes we get with it to see if it helps their stability when they go to school. But we don't know if we're going to do this again next year. I just don't know, depending on what type of outcome we get with it.
And so I can be clear, that 70,000 from the sheet that I have, that direct services. So 40 is for the Science Center. Where's the 30 for? Or is that something that you're going to cover as you go along?
Right, the next one, it's right next after this one.
All right.
Councilwoman?
Thank you, Mr. Chair. With regards to the back-to-school program, and I know this is the first time, will this be over the course of a couple of weeks? If we're doing 1,000 children, will they all go one day? And
It's a
how are-
one-day event, ma'am.
One-day event, and have we identified the students?
Yes,
Okay, and what day will this event?
I don't know.
Okay,
I think it's towards the end of August. I think, I'm sorry, August 3rd.
August 3rd? Okay, thank you.
On that same line of questioning, Director, how would the children get there?
We're working with their foster parents to provide travel and a process for them to make sure that all the either relatives or the adults that are traveling with them can get there for this event.
So how will we track the children that do not show up? Will we get a reimbursement for those that do not participate?
I don't have an answer for that, Councilwoman Conwell, on whether or not there's a reimbursement piece. I would assume that there's some negotiation with that with the Great Lakes Science Center, but I don't have the specifics on that negotiation.
You'll let us know?
Yes, I will.
Thank you.
Thanks. The next one is the $30,000 for KeyBank Air Travel. It's also, we do a lot of visits out of state for children that we have in custody for our social workers to go and visit for their contacts. This is to augment that. And also, and I'll get into this later on, but we have a national foster parent conference that we send foster parents to. This is part of the trip protocol for them to go to a national conference. And I'll get into the why of that later, a few items down.
And who goes on this trip? Is it parents?
Well, there's 2 trips happening. We have many trips happening every month on visits out of state for children in custody that we have to go and check on to make sure that they're safe and that they're getting the service they need or are placed out of the state of Ohio. And the second piece of this travel line item is for a foster parent conference, a national foster parent conference that we send folks to.
Councilman.
Continue.
On that line of questioning for the foster care conference, is that something is that part of the training that we're responsible for keeping the foster?
It's a choice we made to deepen the training for the foster parents. We don't have to do this, but it's something that we believe is important for them to get a different reference point or many different reference points as they work with our kids and families.
And I guess on the same line of questioning, if you could let us know what is the procedure if somebody signs up to attend the conference but then doesn't go, how are we reimbursed?
On something like that, Councilwoman, if they get an airline ticket and we pay for that, they're going. I mean, because that's such a big line item and ticket that we want to make sure we wouldn't go through that if there was any chance of the foster parents not attending that conference.
Okay, so we take out probably the additional travel insurance just
yes,
in case.
Yes. I only have 2 more items to go. The next one is 8,800. Is that broken out for them? For the council? It's to promote the National Adoption Awareness Month. This is an annual event, and we have not indexed it in previous budgets. In future budgets, I want to have this as a separate line item. This is a very well attended. We have many events over that month on foster parent, on adoption, National Adoption Awareness, and as you know, every year we adopt out over 120, 130 children, and this is a very appropriate way to celebrate. But we've always had this every year, but we've never broken it out as an individual index before, and we want to do that now.
Councilwoman?
What month is this? I'm sorry.
I knew you were going to ask me that, Councilwoman. Is it? I believe it's in the fall. I think it's September.
Okay, and then you wanted to index this line item for what reason specifically?
I want to be able to ensure that we have the appropriate resources to do this every year without having to have it be unstable, like it not being indexed, having to go through a process where it could be reduced or have a problem with it.
And the other question I would have for you, the 8,800, is this a marketing measure that you are going to use it for, or is it for the actual event itself, or a combination?
A number of different events. It's not a marketing piece. That's a different index that we use, but this is all for the actual events, plural, that we do.
So are these housed at one of our facilities, or we do it off-site?
Both.
Okay. Okay, thank you.
The last one that I have on my sheet is $24,999. It is it's dollars to help us for a recruitment effort for foster parents, for both network and agency foster parents. We've had over the past 3 years a 40% decrease in the number of foster parents. We are looking to step up our recruitment so that we can service these children in a way that's appropriate. We are also, so you may or may not know that our foster parents can serve in one of 5 different levels: level 1, level 2, 3, 4, and 5. Level 1 being the least restrictive or least number of behavioral issues for a child, and level 5 being the highest. We in Cuyahoga County and CFS have traditionally not had our own agency foster parents in level 4 or 5. We've usually contracted that out to providers. Since I've been here, one of the issues that we've had to deal with is that on many occasions, we have a child that's a level 4 or level 5. We go to our providers and they don't take them for a number of different reasons. So I've instructed the deputy in charge of resources to begin moving towards recruiting more level 4 and 5 foster families. This is part of that effort. We not only have to recruit them, we have to train them at a higher level than a level 1 foster home. It is a big lift, but what's happening now is that we're not able to service. It's a struggle to get some of these placements with some of our more difficult youth, and this is an effort. From a program and a safety point of view, I'm concerned that our volume of foster parents is decreasing over time and not increasing, and this is a way to reshift that. It's also, you may remember, we started a QPI, a Quality Parenting Initiative, that looks at rebranding our foster families so that they are respected, that there's more of I hesitate to use the term professional because that's not what I mean, but we've started down the path of having this QPI process to really emphasize the value that foster parents bring us and to really look at it from their point of view. And as we go through our day-to-day process with the children in care, this is an important recruitment process for us that I'm asking for. This is a one-time. I'm not asking for it again next year. At least I don't intend to. I'll see how this plays out, but this is a way for us to develop that recruitment so that we can get more, a different type of level of foster parent.
Any questions? Councilwoman Conwell?
Recruitment is important for these children that are in these certain levels. I know a couple of friends that are foster parents for these different level children. So I'm just wondering, how will the $24,000, is that bidded out? Is that a contract for somebody to, how will that be spent? Will, you know?
I don't have the details exactly how we're going to do that. We do a number of recruitment initiatives that don't necessarily have to be RFP'd, but if we do, we'll go through that process. I want to lay out a Gantt chart of what we do over the next year for this, month by month.
Councilwoman Brown?
Thank you. Mr. Chair, Director, are we seeing an increase in 4 and 5 for children?
We're seeing an increase of level 4 and level 5 youth that are having more difficulty being placed because the providers are struggling to place them. We're not seeing a necessary increase in the number, but the number that we do regularly get, we're having a difficult time placing them because of, when I talk to the CEOs and executive directors, to be frank, one of the issues that they talk about is liability, that these are really tough kids and that they're afraid in some cases to take them. So sometimes our hands are tied. We then go to an out-of-state residential placement, which is a much higher increased cost. I am a firm believer that when we do the right recruitment for level 4 and level 5 foster family, and we wrap that tightly with mental health services and supportive services, it is way cheaper to do that than to send a child or a youth out of state. I know that from experience. I've done it before. It's just, it takes some time to have that type of recruitment protocol in place and to get the support services in for that foster family to feel safe and secure. But I've done this where, I'm paying $600 or $700 a day residentially out in, Delaware, and I could do this for, $200, $250 a day with a complete wrap with mental health service support here. I mean, it's just a no-brainer, but we have to build up to that. We don't have it. And I can't get, I work with the providers. I have very good relationships with them. And I said to them, let's work together, it's not a money issue for me, it's taking a step forward issue, let's work this together, we can do this. And I got some that want to try it and some that want to have no part in it. But I can't count on that, I can't count on them right now, so I want to make sure that I have the depth of resources to be able to handle the children that we have, the children and youth.
When you mention the depth of resources, I would imagine that you have a goal of how many parents or foster parents you'd like to recruit within this time frame, given the fact that you don't want to have to repeat this.
50.
50, okay.
I gave my deputy a goal about 5 months ago of recruiting 50 level 4 and 5 homes.
Councilman Miller?
Mr. Chairman, Director, are any of these items that we discussed urgent? Time sensitive?
I would say 2 of them are, in my perspective, actually 3. The 3 that are, in my view, is the Opentable Contract of $70,000, the 135 for the readjustment to the prosecutor's contract, and the one I just spoke of, the $24,999 for the level 4 and level 5 recruitment of foster homes.
Okay. And Mr. Chairman, Director, procedurally, we don't actually have a piece of legislation in front of us. This is just a discussion of the item that was withdrawn from the last bi-monthly fiscal. So normally what happens is that if the committee suggests that after review that we're okay, well then the administration takes these items and puts them into a future bi-monthly fiscal resolution. And so what I'm suggesting is that if you have a sense of urgency, that instead of waiting for a new one to be sent over, we have one that's on the agenda for next Tuesday's council meeting, and you could ask OBM to prepare an amendment that would amend that resolution with this material, and then it would be then it could be approved next Tuesday at the council meeting. That would of course be contingent on the information that you promised to Councilman Greenspan being provided ahead of that date. So I just put that out there in case you want to try to move this more quickly.
If that is an agreeable course with the council, with HHSA council, I would be glad to do that. I want to make sure that Councilman Greenspan gets the information. We will get it delivered to the council chambers by noon on Monday at the latest. Each one of these items having those 4 questions answered.
Thank you. And Mr. Miller hit it on the head. That is the procedure I was going to recommend. It's the only procedure.
Okay, thank you.
Any further questions? If not, well, thank you.
Thank you. Thank you.
Mr. Chairman?
Councilman?
I would like to take this moment to apologize to Providence House. I have a schedule conflict and have to go to another meeting, and just want to say that I know that you do wonderful work. I'm going to review the written materials that you sent, but I'm not able to stay for the presentation. Thank you.
Well, thank you. At this time, Providence House, if you would like to come up and present and share with the committee about what you do.
Good afternoon. I want to thank Councilwoman Conwell for your invitation to be here, Chairman Jones for allowing us to present. Council Member Miller, thank you so much. You've been very supportive in the past, so appreciate it. And Councilwoman Brown. So I thought what I'd like to do, I'm Natalie Leak-Nelson. I'm the CEO and President of Providence House. I've been the Executive Director of the Crisis Nursery for over 15 years. What I wanted to do, I think, to kick it off in a very brief way, is to share the experience of the children that we serve in our crisis nursery. They are all Cuyahoga County children, and then get into some details about how we have been partnering with the county in a very informal way for many years, and maybe think through with you what the best process forward to continue to strengthen that partnership might be. So I'll just get this going here, maybe.
When my mommy brought us to Providence House, my brother and me were really sad. But everyone was so nice. The first thing we got was our own teddy bear to snuggle. We got our own room with our own beds. We haven't had our own room in a long time. And we got our own suitcase full of new clothes and shoes. And we get to take all of it home when Mommy gets better. We're having so much fun here. We're making lots of new friends. And do all kinds of cool stuff. We do art projects, play on computers, watch movies, play loud music, dance like crazy, and read books when we're not doing yoga. When we don't feel good, there's a nurse here to take care of us. We don't have to go to the hospital. I still go to school every day to see my favorite teacher and friends. I still don't like doing homework. The school is here to help me. They also give us snacks and give us really yummy food. We are never hungry here. I love everyone here. They are so nice. They talk to me, they sing to me, they give me hugs when I feel sad. We never feel scared here at bedtime. The people who take care of us, they rock us to sleep, tuck us in, and wish us sweet dreams. I dream about going home with Mommy soon, and I'm so happy that Providence House is helping me and Myra. I hope you can help her. Please. I love everybody here.
So that's just a quick view from our children's perspective. The work we do is very serious and critical work, particularly for the families in Cuyahoga County. And so sometimes we forget from the children's experience some of the scary places that they've come, and they land in what a lot of our partner agencies call kitty camp. And we're really working on the whole child while they're with us. So I wanted to take a minute today to give you a quick overview of our services and then get into some of the data around how many of the county children. Changing needs of children at risk of abuse or neglect in our community. Where's that coming from? A new group of children in need captured our attention and captured. There's a different video loading. The Wellness Nursery was born. Oh yeah, just close it. That's a whole different ball of wax. Okay, so Providence House is Ohio's first crisis nursery. We're actually one of the nation's largest and longest running crisis nurseries. We were founded in 1981. This is our 35th anniversary. Over 8,000 children have been protected and served at Providence House. We are licensed by the state of Ohio through the Department of Job Family Services since 1990. And we are a unique crisis nursery in the nation in that not only are we providing emergency shelter for children at risk of abuse or neglect, but we're taking a two-generation approach and focusing on parent supports for family preservation. We did receive the Attorney General's Promising Practice Award last year for our program, and our vision is that children everywhere are in safe, loving families free from abuse and neglect. And we do that in three ways through our mission, by protecting children, empowering families in crisis, and building safer communities. So for children, we really focus on the whole child, as I said, their physical, emotional, developmental, educational needs. We do It's free care, it's voluntary. These are non-custodial, family voluntary admissions into our crisis nursery. We are 24/7 shelter for these children. They are newborn through age 10. We have 30 children at a time on our campus. We do lots of assessments and activities, trauma work, trauma therapy, school readiness skills, triage medical care, all on our campus for our children while they stay with us for up to 60 days. To average length of stay is just under a month or so. The goal is to keep the children safe while we empower the families, which is our next piece and probably some of the heaviest lifting work that we do. And we really connect our families to not only individualized parent education, mentoring, and family preservation services at Providence House, but intensive wrap service case management with over 40 partners in the Cuyahoga County area. So a family may be working with 4 or 5 different agencies. We're helping to make those connections, maintain those connections, check in on the family's progress, all with the goal to develop safe, stable caregivers that children can safely return home to. We are certified trauma specialists and have a trauma-informed environment, as well as do trauma work with both our children and their parents, who are frequently, as you can imagine, adult survivors themselves, now trying to parent children. We also really work in the community. We've got great relationships with public-private relationships with over 40 human services partners, everything from medical community to drug and alcohol treatment, mental health services, housing, tenant advocacy, on and on. And we do over 150 community events every year in this community to talk about child abuse prevention and the need for early intervention for children who are growing up in poverty or at-risk situations. Last year, we served 272 children from 121 families in over 30 zip codes in the greater Cleveland area, all Cuyahoga County children. Risk for abuse and neglect, homelessness, unsafe housing, mental health, domestic violence, incarceration of the parent. And we are really the place where a family can turn when they know they need help, but if they don't have safe caregivers, a lot of our families, which are primarily single mothers, are reluctant to go into a 90-day inpatient or a 60-day inpatient because they don't know that their children will be safe if they make that choice. And so we provide that voluntary alternative space for those people, for those parents to choose to bring their children. We keep the children safe. We let the parent then connect to the supports and services they need to deal with their own crises, knowing that their children are safe, and we're working to keep that family together. This year, we're on trend to serve over 350 children at the crisis nursery and about 180 families. I mean, you know these statistics certainly from your committee. Cuyahoga County still is #1 for child maltreatment in the state of Ohio. There were almost 50,000 calls to the hotline last year. 60% of our kids are witness or victim of violence before they're 18. And child maltreatment without early intervention has lifelong consequences. And we actually put a timeline based on a number of research studies in your handout that kind of gives you the experience of a nurtured child or a child at risk and what they're seeing, what they're experiencing at different ages in their lives, and the research citation that talks about, unfortunately, to the birthday, we can almost tell you when they're going to drop out of school, be a teen parent, be diagnosed mentally ill, have a chronic health disease. And so the earlier we can intervene, the earlier we can help families get back on track and nurture their children in community, the stronger our community is going to be. And it costs a lot of money, as you know, for these children. And so there are some calculations on the document that I gave you, and also annually, the public cost on these kids, lifetime cost on these kids is about $200,000. So it's better to get in there early. What we are really proud of with our program, as I said, we've been doing this for 35 years. We actually did an external evaluation with Case Western Reserve University. We wanted to understand, do the children that we serve after service, are they substantiated? Do they end up in foster care? And for those that do not, what services do we deliver that had the most impact on our families? And what we found was the more doses of parent education, case management services, and aftercare services that families received, the less likely their children were to be placed in foster care. The study found that of the almost 400 children that were, it was our data against DCFS data, 82% of the children that we serve were never substantiated and never entered care, even 3, 4, 5 years after they had been through our program. Interesting note on that 82%, 65% of the children in the study already had open cases or prior foster care history with DCFS, yet 82% of the group remained together with their families. The other nuance of the study that was particularly interesting, and we're going into a second wave of evaluation, is the racial disproportionality in our population very much aligns with what we see with many of our public systems, including DCFS. And our researcher was interested to see, are our minority families more successful in this very intensive individualized model than they are through some of our public systems? And we saw the complete reverse trend, where most of our public systems, the Caucasian families are more successful. Our minority families, African American, biracial, were by far more successful and less likely to have their children substantiated or placed in foster care after going through our services. So we're looking a little bit further at that cultural competence and intensity of service for those families. We did receive our 3-year CARF accreditation in 4 program areas just this past spring. We're licensed by the Department of Job Family Services. And as a nonprofit organization, we hold ourselves to the highest standards of transparency and fiscal responsibility and stewardship. We have just been named one of the inaugural platinum nonprofits for GuideStar. Our budget's about $2.8 million. 80% goes directly to program services. We are almost 90% privately funded. The public funding that we do come is directly through the state of Ohio and advocacy that we do in Columbus through the Office of Families and Children, Victim of Crime Act, and some meal reimbursement at the state level. We have great relationships with many of the legislators and state agencies. One of the reasons we're here today is the question I always get asked is, well, what's your relationship with your own county? And we currently receive no funding or have no contracts for services that we provide. So our partnership history is long. Before I got there in '91, there was a per diem contract for children. These were transitional placements for kids that were taken into emergency custody, and they were keeping them at Providence House until they found a family that was appropriate for the children. Over the period that I've been there and we've been tracking, because I'm a data dork and we want to know everything, our direct referrals or open case involved families have ranged between 33 and 53% of our total annual census of children. So these are DCFS involved or directly referred children in our population. You'll see some of the other awards contracts, so it kind of comes and it goes and it comes and it goes. And so just to give you a sense, so we've tried to partner through DCFS with 4 directors, and so wanted to just kind of share the history of where we went with that. As you look at the involved children, we went back to 07-08, we're on a June 30 fiscal. You can see again that 33 to 53, last year we were about 40%. So these are involved kids, so it could be a direct referral from the hotline, an open case, a limited open case, an active open case, or a custody case. The next slide these are direct referrals. So a lot of times, so the difference between involved and a direct referral, so anywhere between up to 20% or so, but last year it was 9%. So we typically are hovering somewhere between 9 to 15%, where a worker called and made the referral, or the hotline called and made the referral. So it was direct. So the difference when we look at that 33 to 53 versus the 11 to 15%, the difference is families that get to us in another way, and then we discover that they have an open case or they have county involvement. Then we reach into DCFS and say, all right, who's your worker? Let's call them, so that we never are working with a family where DCFS is involved and they don't know the family has gotten to us in some fashion. So if it's a not direct referral, we are reaching in and contacting the worker assigned to that family. So just kind of look at it in a different way. Total number of children is in the sort of rust color bar. The overall involved children is the green bar, and the children directly referred from DCFS and a direct call is in the blue bar. So you can see almost, at points, almost half of our population are DCFS involved children. This again slices it a different way. DCFS involved, hotline, limited, open case, active, and custody cases. We also work with the Office of Homeless Services. Historically, about 30% of our children are coming to us because they are homeless or they are living in really unsafe, unstable conditions. And so the Office of Homeless Services came to us when coordinated intake started because we already know there aren't enough beds for children. And so we get a couple different types of referrals through coordinated intake. There are no beds, so it's an overflow placement of the children so that they can get them safe. Or the coordinated intake, the shelters themselves and the families understand that particularly for very small children, the community shelters are not safe spaces. These are mixed populations. You've got mental health and addiction issues in the shelters. And so often the recommendation is for very young children, 5 and under, 3 and under, that they not stay in the shelter because of the risk to the children and the safety concerns. We also get referrals when families are doubled up, tripled up, or caregivers that are unable to be with their children due to other situations, inpatient treatment, mental health issues, et cetera. But the family is homeless and the children will come to us that way. We've been doing this with coordinated intake in the Office of Homeless Services since June of 2013. So, and in looking at sort of the initial service data, 85 children have flowed through this way. Again, there is no contract, there is no per diem, although the other shelters are being paid and have contracts and per diems. So our total, we've done almost 2,000 days, and that number would go up from here given where we're at in the current fiscal year. But this kind of gives you a sense of average lengths of stay, how many we're getting through, how many days overall for overflow, shelter combined. So we really are here today to not only share and educate the deep relationship we've had for many, many, many years with DCFS and most recently Office of Homeless Services, but to respond to the question we're getting from our own funders in the community, in the private sector, in the corporate sector, and certainly from the General Assembly in Columbus about how can you partner, how can we partner better with HHS and the divisions in HHS that we have had significant history with. We have a shared client population. We have very successful outcomes for these populations. What are some of those ways? Because typically as we look at the relationships that HHS has, it is through formal MOUs, contract services, fees for services, and we're running into roadblocks on that and not sure how to move that ball forward. And also to really begin to think, Cuyahoga County has always been or has been seen as very innovative, particularly in child welfare and in human services. And what are some public-private partnerships that, given the very unique situation Cuyahoga County is, to have a crisis nursery program like you have, which doesn't exist anywhere else in the state of Ohio and doesn't exist anywhere else in the USA. In fact, we consult many of these nurseries to try to become a model like this. How can we put forth a public-private pilot partnership around things like alternative or differential response? We know the kids we serve aren't ending up in foster care. The traditional, transitional trauma admissions, those emergency custody cases in the middle of the night where the kids are in waiting rooms for a day or 2 or 3 until you can find a foster home when they could be in a safe space with trained people and medical professionals and transitioned more effectively. And that is allowed allowed by the legislation that we enacted to allow for CPS to use those transitional opportunities for admission. And we've recently been contacted again by Metro Health, who is our medical partner, about a foster care triage overnight program where we are 24/7. Right now, they take the kids to the emergency room in an emergency custody situation. They call the NP, they wake the NP up, they go to the emergency room, they triage the kid, and then they go back to DCFS and wait for a foster home. Metro is saying, well, you're already there, your staff are already awake. If you had beds available, could we just bring the kids there, have the exam done in the morning after they've rested and they've been calmed down, and then can work with DCFS on a transition. So lots of great ideas and innovative ways to reduce costs, not have kids move up into the system that maybe we could prevent from escalating. And so we just wanted to come today, share that information, get some wheels turning and maybe some ideas generating about how we can more formally partner with the county and the children that we both love and serve. So I don't know if you have any questions, or I threw a lot at you.
Oh, that was good. Thank you, Mrs. Nelson. And in fact, let's open things up to the committee. Are there any questions? Councilwoman Conwell?
Through the chair to the director, do we get children from other parts of Ohio since the state funds us? Does your
We
organization?
can, and we have. In the last year or two, we haven't. We can take kids from actually anywhere in the state of Ohio, any county in Ohio. We can take kids from out of state. As an example, when Katrina hit, there were families that Red Cross referred the children because the parents were getting medical treatment at the Cleveland Clinic. So we're this, a temporary safe place for children when parents are unavailable and can't be there.
Second question would be, going on your slides on page 7, and you talked about the not direct referrals and the direct referrals. Is there a cost difference depending on who does the referral?
No,
No, okay.
we just track kind of the source.
Source, okay. And then my third question would be, is there a chance the state would decrease your funding if a financial partnership was reestablished with the county?
I don't believe so. The streams that we're engaging are really around the OFC funding is really engaged around the General Assembly's goals to potentially replicate this program in other counties of Ohio. And so that stream of funding is by the licensed bed with a goal that we would kind of propagate other services into high-risk counties.
All right, I asked the Director Pristo to stay so he could hear your presentation. So I would like it, and believe me, this was just a coincidence on my part. I didn't know the chair was bringing in Director Pristo, but I did know about the. So it's perfect timing, so to speak. So if we could definitely set up a meeting with Director Pristo, I would. I'd like that after the presentation. Is that okay, Director Pristo?
Absolutely fine.
All right. And then that way, you two could sit down and talk about, because I've come to the center, I don't know if others have, in regards to how we used to, as a county, used to participate, and then something happened, way before our time, and seeing that the work that they do currently for us. So I just wanted to make a connection. So it with my questions.
Are there any other questions?
Feel free to come and visit if you ever have the time.
Again, thank you for the presentation. Is there any miscellaneous business? And Chrissy, has anyone signed in for public comment?
Yes, Mr. Chair, Ms. Liu.
Ms. Lou, please come forward.
Good afternoon.
Good afternoon.
I'm here to thank all of you to give us the opportunity for the public hearing 2 weeks back. But of course, that day there were all different people coming to present whatever they already have, or either in mind or they have actually done. But the thing is, at the end, I think chairman was thinking that maybe OHS should present the council with, the committee with the contracts to see if there's anything, good or bad or whatever about there. But one thing I would guess for sure, there's nothing mentioning about like a bad staffing, no management, no consequences about that. So here I would like to let you know, I myself personally, I have been openly insulted, humiliated, even attacked by the people working there. Not all the people working there are bad, but unfortunately you just have those few. And they just ruin all the good works all other people collectively trying to be, trying to do. So I think we should have some actions instead of just listening, because this has been prolonged for too long. And I thank you for your attention. Thank you very much.
Thank you. Chrissy, has anyone else signed in for public comment?
No, Mr. Chair.
All right. Well, if nothing else holds our attention, our meeting is adjourned.